on the phone call between the President and the Prime Minister of the United Kingdom, Mr. Johnson, the phone call was indeed focused on the proposal or the implementing regulation adopted by the Commission for transparency and authorization of export of vaccines. I think you got a readout from the UK Prime Minister on the points that he made. Referring to the point that you specifically raised on whether doses could be sent from the United Kingdom to Europe, you simply need to remember the context in which we were last week, where we had a debate as to whether plants that are situated in the United Kingdom and mentioned in a contract that we have with a pharmaceutical company are meant to provide doses to us or not. And we wanted to make sure that our understanding that there was nothing on the UK side which impeded the delivery of doses from UK plants to Europe, that this concern was not justified, and in fact it was possible for doses to come to Europe. And we were reassured by the statements of the Prime Minister, just as I think he was reassured by the statement by the President that, of course, our intention is not to block deliveries of vaccines to other countries that have valid contracts with producers, pharmaceutical companies that produce in Europe, and therefore that we are trying to ensure that everybody can get the doses that they have contracted, including the European Union. On the 9 million doses, quite frankly, that's a question that you should address to AstraZeneca. We here in the Commission want to make sure that we obtain the doses that we have agreed on with AstraZeneca in the context of the advanced purchasing agreement. The President welcomed yesterday this step forward, but it is not our business to know exactly which plants these doses come from. That is the business, and rightfully so, of the company. As to events last week, well, let me tell you that we believe that we are on the right track since the beginning of this pandemic in ensuring that there is as cohesive and as effective a European response as possible. That is what this Commission has been working on at full speed for now basically a year, since March of last year, when the pandemic really became an issue, a priority issue. And we have done this in parallel to delivering on the political priorities that the President had set for her college before the pandemic, and by the way as well delivering on the agreement with the United Kingdom. So we're having an extremely productive we have a very productive mandate since the beginning. There are always going to be issues along the way, and we accept that. The important thing is that we react, we correct, and then we try to improve the situation when it comes to delivery of vaccines for EU citizens.